All right, now it's time to change a central line dressing. Now, central line dressing is one of those things that's going to, generally, at least on my unit, is kind of like a standard. It's like a standing order thing. It's changed every Wednesday in PRN. Different places may have different protocols. I don't know. My unit, that's what we've got to do. So I really don't think there's an actual doctor's order to change the dressing. That's just like a standing order. I think that's that way everywhere, but check your own unit policies. So we are going to look at this patient. Now we have several different things on him. Now we have here, this is a Huber needle, and it's got a needle that goes in there at a right angle to all this, straight down in. Underneath his skin is what's called an infuser port, and I'm going to just take off this little square and show you. And this needle stabs down into this to infuse their medicines. So this is placed under the skin for people that are needing frequent infusions and whatnot, like chemotherapy patients and etc., etc. Now this is a central line, and it goes into one of the major arteries. A lot of times it's subclavian or internal jugular. We have some other examples of stuff here for you. This is a PIC. You'll see them usually brachial. But from the brachial, this thing here goes all the way up and around to the major artery. And this is a single lumen. There are double and even triple lumen PICs. And we have another double lumen central line here. Another type implanted under the skin. And wow, a double under the skin. So, those are some of the examples that we have here. Now what I have to do is I have to change this central line dressing. So, I'm going to wash my hands, because there's the stuff you got to do. And with this one, you don't necessarily have to check the doctor's order, as I said, but you do have to wash your hands, ensure adequate lighting, patient privacy. I'm also, just because I always do it, if I'm just starting the shift having to do this, I'm going to check my patient's wristband and whatnot, just to know who I'm working on, etc., etc. So this is a sterile procedure. You do not want to get a central line infection. They can go septic, because that's infection right in the blood and it can travel all through the body. So this is a sterile procedure. Now my patient's going to be alert and oriented. If they're not, then we've got a problem. I'm going to have helpers in here or whatever. To be honest, in 20 years I've never had to change a central line dressing on someone that was so confused they were in restraints. I have changed central line dressings on people that were sedated, that were unconscious. But I've never had a combative patient with a central line that I've had to change, thank goodness. So I would raise my bed to appropriate working height for myself. Now if a patient can turn their head, I'm going to ask them to turn their head away, because I don't want them breathing germs down in it. But sometimes people have neck surgery, or maybe they're contractured a certain way. I have had a person with his head contractured to the same side. Well, I put a mask on him, because I don't want his germs blowing down. When you're breathing, germs are coming down like a 45-degree angle. So, we are now going to get started with our central line dressing. Okay. I'm going to open my kit, and once again, as you're always opening your kit, you're always making a sterile field. I'm always opening the first one away, then the other two to the sides, and the last one pulling down towards myself. Now they do have gloves in here, but once again, I am allergic. All I want to get off this kit is my mask. Now I don't want to put on my sterile gloves before I grab that mask, because when I put it on, I'll contaminate my gloves. So I got to just carefully reach through and only touch my mask, and generally your mask is going to be right on top. So it would normally be right on top, and I could just reach right down and grab it. And notice I'm kind of stepping away a little bit. That's because I'm breathing down these germs. I don't want to be breathing them on my kit. The wire is at the top, and I can pinch it to close it on my nose. So now I would next grab those gloves, but since I'm using these special gloves due to my allergy, and once again, when I put on my gloves, pay attention to how I do it. I'm not going to contaminate them. And if I do, because sometimes I might put them on and, you know, the fingers flop around and hit the back of my hand, I'll just throw them away and grab my spare pack I always have with me. Notice how I got my sleeves rolled up so they're not going to be fumbling around, falling on my, on my forearms in the area that I need to work with. You want to have everything out of the way. Keep yourself and your patient out of trouble. Now this is a little disc that's like antibiotic. I'm going to open it up and have it ready. Discard that, I don't need it. Notice I'm not throwing it down in the trash like that. I pick it up and toss it in. You want to keep your hands, try to keep your hands if you got sterile gloves on above your belt so you don't knock anything with them. Now I'm just checking all my equipment here and I've got it all. Now I'm ready to get started. Now once again, when you're doing this, you could say oops, as long as you got a way to remedy it. Because I'm looking at this patient going, well, I'm ready to do my dressing change. Oh, by gad free, look. There's a dressing on there and I've got to get it off and I got my sterile gloves on. What am I going to do? Well, I should have taken that off with clean gloves and then put my sterile gloves on. But no harm, no foul. I got an extra pair of gloves here. I'm going to go ahead and take this dressing off and then just put on new gloves. Now, if you can zoom in here, there is a line right there. Down here is solid. Now, whoever put this on made it really tough for me because they put it on like this and then put tape on it. So now, see, the tape is hooked in between here. Now what you should do is put it on like this so that when I rip the tape off, it'll come right off. And there's nothing holding it in. So now, that's why the pack comes with a pair of scissors, because I'm going to have to use these scissors now, these sterile scissors, to cut up the line. And I definitely don't want to nick my line because that's going to cost the patient a lot of pain, thousands of dollars. That's why this is so very dangerous and nerve-wracking when people do this. And once again, I got some initials here so I know who to go to and say, what are you doing? Putting that on backwards, screwing me over. I had to cut that off and it scared me because this is very, you got a patient there, maybe their family there watching you. You think it's nerve-wracking when I'm watching you. You let a family watch you and have something get screwed up and see if that doesn't make you sweat. So here we go. I'm going to go ahead and cut this very carefully up the line because one of my colleagues totally screwed it up. Now I'm not saying this to the patient, no matter how mad I am, because they might have to take care of this patient again. But, now I know who to be mad at. Throw that down. So always in front of the patients, you stay calm and cool. But hey, you can be mad at your colleagues, that's okay. Happens all the time. So now, I will take this off, and I'm being very careful. When I'm taking this off, I'm trying to pull up that away, although it's very difficult to do, because when you're pulling down, you might pull you could pull this out. So I'm trying to be very careful on how I'm pulling this thing. And if I didn't have on sterile gloves when I started to take this off, when I saw that thing on backwards, I would put sterile gloves on. Because this, like I said, this is really difficult to do when it's twisted around backwards like that. So there, we got it off safely. Now, this was against the patient, so I'm going to consider it contaminated. I just like to put that stuff in the middle of my glove. Now I can throw my glove away and get my other set. So we put on our sterile gloves, and they got to be put on properly each time. Now in the sim lab, a lot of times I'll say, hey, you put them on right the first time. You just tell me you're putting them on, and that's good enough for me. But I just always like, for students, the more times you see gloves put on properly, the better off you are. And you get to where you can do this practically in your sleep. But I have put on sterile gloves and not remembered how I put them on because it's 4 in the morning and I was actually halfway asleep. I'll put on new gloves because I want to ensure that I put them on properly. So now I have sterile gloves on, I have my patient with the dressing off, I'm ready to go. Now we have several different types of things here. These are little alcohol sticks. They're like Q-tips. I need some Q-tips to simulate these. And this is a big ChlorPrep, and a lot of times this, we'll use this too. So luckily it's the sim lab. Now I'm not going to rip this open because, it's a big mess if you do. But I'm going to simulate it with these little Q-tips. So there's 3 of those, so I have 3 of my Q-tips here. We're ready to go. So I would rip this open. And the pack's sterile, it's in my sterile kit. So I can just pick it up. Now what I'm going to do is the first one, I'm going to go around the insertion side as close as I can. Try to get up under there. Okay, now I'm going to go in a little bit bigger circle. Up under, come around, under, a little over, kind of wash the top of that off. Around, bigger circle, there we go. Now I can discard this one, pull out a second one. Well, once again, brand new, so I'm going to start in the center, work my way around, over and under. Little bit of a bigger circle here, working my way out. And a lot of times patients want to talk to you. I'm like, please don't talk to me during this because we're spreading germs when you talk. I'd rather just get this done safely. And a lot of times patients go, hey, I appreciate that. Now, if you feel these are big cotton tips, like almost as big as your fingernail. These little Q-tip things are small, but just know these are a lot bigger. And after you're done with the sim lab, heck, open them up and look at them if you want to. Or you can anytime you want to, I guess, but I'm just saying, you'll have to let it dry out and all, but these are big, giant Q-tips compared to these little things. So I got the last one, so I can just throw that away, and I'm going to, once again, And it's much easier with that bigger Q-tip to do this too. I have to go just down around the end of the hub. Okay, so now I've got all that washed off. I can break this and use this too if it's there in the kit. Just dab in the center and kind of work your way around. Under, over, the whole area. Okay, now I got to give that a minute to dry. And notice once again, I'm tossing it to the trash. I'm not laying it in the trash. I'm tossing it over there. Now this is a skin protectant prep pad. I got to give that a minute to dry. And you can see a wet sheen on the patient, and you can see when it's drying and going away. I'm going to rip this pad and just take it. And I don't want to get this on, on the insertion area, but I just want to go around it because this is what's going to prep the area for the tape. Because I'm going to tape this down. Okay, so that's done. That'll have to dry for a minute. Now I got this little antibiotic pad or disc. Now notice the disc has a little opening, a little like a C. I don't want to put it up like that other one was. I want to put it so that that will fall right off when I go to take the tape off. So I'm going to put my little disc on, and it will be down like that. Now, sometimes the line might want to go up. It just depends on the type of line. Then it would be up like that. Just depends on how your line goes. This line happens to be going down, so I'm going to stick it on going down. Okay. So now we're ready to, need some Tegaderm here, to tape.
Tegaderm.
So my kit didn't have Tegaderm in it, so I'd normally have to go holler for someone, hey, grab me some Tegaderm.